Hi, I'm Dr. Elisa Port, coming to you live from the Dubin Breast Center at Mount Sinai in New York City. And I'm here today to talk to you a little bit about the impact of COVID-19 on our patients with breast cancer. Women who are diagnosed with breast cancer in this incredibly trying time, of course, need to be evaluated by their doctors. And we are all still quote, open for business in terms of evaluating patients with newly diagnosed breast cancer. It's important to know that there are a number of different treatment options for women with breast cancer, and there are different subtypes of breast cancer, and there's no one size fits all. There are certain types of very, very early breast cancer that can be safely delayed for treatment or put on a medication to temporize and prevent continued spread or growth of breast cancer until we get to a time where the threat of COVID-19 infection is less and we can proceed with other treatments more safely. In breast cancer, thank God, there are very few emergencies to the level of if someone doesn't get an operation or get treatment within 1 or 2 days, there's going to be a bad or worse outcome. With breast cancer, in many cases, we do have the luxury of some time for delaying treatment without it impacting overall survival rates and overall prognosis. But again, there are different subtypes of breast cancer. Women can, there are a variety of different treatment modalities that can be taken by women during this COVID-19 epidemic. And it's all about balancing the risks and benefits in any individual case. Women with more aggressive types of cancers can get chemotherapy started during this time. Of course, receiving chemotherapy in the setting of a viral pandemic has its own potential risks of immunosuppression and so forth, so we don't take those risks lightly and we weigh the risks and benefits. Women can get surgery during this epidemic, and we are deciding on a case-by-case basis whose case should undergo surgery now, even if a trip into the hospital can put them at some risk for contracting COVID. So there are those patients where we're weighing the risks and benefits and deciding that yes, surgery at this point is appropriate to do. And then there are also cases that are slow growing, extremely indolent, where we can again delay care for 1, 2, 3 months with or without putting them on a medication, an anti-hormonal medication that can absolutely be effective in reducing the risk of growth and spread and buy us some time in those people while obviously still treating the cancer actively. So women can receive treatment for breast cancer during this time. I just came up from seeing one of my patients who's on her last chemotherapy treatment to talk to her about the planning of the next step for surgery and the optimal timing for that. So yes, surgery is going on for breast cancer, albeit in a more limited basis where we're trying to take our patients who are not at risk for imminent growth or spread and delaying them, and taking our patients to surgery where we feel like delay in their treatment could have some adverse impact. Any woman who feels a lump or a new suspicious finding should not delay seeking medical care. Our breast center has basically scaled back all what we call non-essential visits, meaning yearly routine mammograms, yearly just check-in follow-up visits. And we've done that with the specific goal of reducing traffic in the center so that patients who do need to come in because of a new diagnosis, because of a new finding that they're concerned about, can come in with lesser risk. So right now, when you look at our waiting rooms at the Dubin Breast Center, they are empty. And that's because when patients come in who need to come in, we take them right into a private exam room to minimize the risk of exposure. And And that's what we've done, is created an environment so that patients who really do need to be seen because they're concerned about a new lump, because they're being treated for breast cancer, can be evaluated. And yes, we are still doing imaging studies in those patients, exams in those patients, biopsies in those patients, et cetera, to get a clear sense of what's going on. So that is still ongoing, and women who have some concern should absolutely not delay seeking medical attention. In general, you know, the two biggest things lifestyle-wise that women can do to reduce their risk of getting breast cancer, or if they've had breast cancer, reduce the risk of it coming back, there's really two lifestyle factors. One is to try to maintain a healthy body weight, and the other is to avoid excessive alcohol intake. But these, of course, are lifestyle factors that will only have an effect over the long haul, over a long period of time. There's nothing really specifically that one can do in the short term to impact their risk of getting breast cancer, or impact their risk, if they've had breast cancer, of that cancer coming back. I would say the most important thing that someone can do at this point is to stay in quarantine, to be safe, to fulfill their public responsibilities, to not infect others, and so forth. And if someone is very healthy at this point and does not have breast cancer and doesn't feel anything that's of concern to them, their number one priority is to stay safe and healthy from COVID-19. As a breast surgeon, I would like to tell people that we are really at the epicenter here in New York City but it affects all parts of the country and, of course, all parts of the world. We're really in an epic battle here, I say, against both COVID and breast cancer and cancer in general. And I feel like our patients who are diagnosed with breast cancer need to be in a center of excellence where we can balance the risks and benefits of both of these things and optimize treatment for each individual based on their particular case. There is no one size fits all. There never has been, but more than ever before, we need to take all of these extraneous factors as it relates to COVID and the risks of that to each individual and balance on a case-by-case basis. Thank you so much for joining us today. Coming to you from Mount Sinai. Be safe, be healthy, and if you have any concerns, please don't forget to seek medical attention.